Hi, it's Christina with the Sisyphean Journal. Today I want to look at 10 signs that an abortion facility is not safe for the woman. After abstracting thousands of abortion injury and death cases, I've seen patterns about how to spot unsafe facilities. Now remember that you enter any abortion facility entirely at your own risk. Just because you don't notice any of these signs doesn't mean the place is necessarily safe. It's just that these particular signs should set alarm bells ringing in your head. You'll probably want to investigate further or go someplace like abortiondocs.org. That's short for abortion documents, abortiondocs.org. That is an excellent resource to see what sort of information has been gathered about that person or facility. And Abortion Docs does gather everything they can get. They will post an inspection report even if it shows no violations. So it is a place that, even if you're pro-choice, you can trust. And I would like to know why the pro-choicers who supposedly care so much about abortion safety aren't running Abortion Docs. Now, some of these things may seem so outrageous that you'd wonder how any place could operate doing these things. And you'd marvel that women just don't turn around and walk out when they see these things. But all I can say is I have seen the documentation myself. I've seen the pictures. These kinds of things do indeed happen. And I think the mantra of safe and legal has led to a false sense of security. Many women are going to dismiss any fears about the clinic or the doctor because they assume somebody must be overseeing the place or wouldn't be operating openly. And this is not necessarily the case. Women entrusted themselves to Kermit Gosnell and his house of horrors. So, in the order you're most likely to notice them. Bad sign number 1. The person who answers the phone when you call for an appointment verifies your pregnancy and tells you how many weeks pregnant you are. You cannot make a diagnosis over the phone. And even with an examination, a practiced abortionist can be off by several weeks and sometimes even months in estimating how far a pregnancy has progressed. In facilities that pay doctors on a sliding scale for how advanced a pregnancy is, the final determination of his pay is typically made after the abortion by comparing a fetal foot to a chart. Now, if that kind of accuracy is necessary to determine how much the doctor should be paid, what kind of accuracy do you think they need to be performing the abortion safely? Secondly, sign number 2, pro-lifers outside the facility are handing out copies of lawsuits against the facility or the doctor. This one shouldn't require any elaboration, but women will walk into the clinic with copies of these malpractice suits in their hands and climb on the table anyway. And it's probably because by the time they get to the clinic for their appointment, they've got tunnel vision. They're in a let's get this over with mindset and have turned everything else off. And that's why it's important to have a friend or companion with you who will look out for these and other signs and get you out of there if there are any red flags. Another bad sign, you're asked for payment in full up front before any examination or counseling has been done. As I said in number 1, it's not possible to verify how advanced your pregnancy is without an ultrasound. Unless, of course, the abortion's already over and they're measuring the fetal foot. So how can they answer the questions about the risks, the fetus, or the procedure if they don't actually know how far advanced your pregnancy is? Number 4, you get vague, reassuring answers to your questions. Now, this might not mean quackery. It might just mean paternalism. But either way, you're being deprived of your right to make an informed decision. Any discussion of the risks that isn't covering failed abortion, hemorrhage, and infection is glossing over potential problems. Ask where the crash cart is and which hospital you'd be taken to in case of an emergency. If they can't tell you right away, they aren't going to be able to remember it right away if there's a life-threatening emergency. And if you ask questions about the fetus and you get answers that don't jibe with what you've seen on pregnancy websites like Baby Center, Parents, or What to Expect, they are not being honest with you. And how can you trust them with your life if they won't give you honest answers to simple questions? Red flag number 5, you hear other patients moaning or screaming. Obviously, this place is not providing adequate pain management, so what else might they be skimping on? Sign number 6, the facility appears dirty or disorganized. Abortion is a surgical procedure with inherent risks. If they are not keeping the waiting room, counseling area, restrooms, and hallways clean and sanitary, they probably aren't keeping the scrub room, procedure room, and other critical areas sanitary either. 7, there is a putrid, rotting smell. Any fetal tissue should be properly labeled and sent to a lab, not left lying around to rot. If you can smell it in the patient's areas, this is a very dangerous sign that protocols are not being followed at that facility. Red flag number 8. Staff can't immediately answer questions about where they got their professional training. Some places might have a doctor on staff, but only on paper. Okay? That doesn't mean the doctor, the person performing your abortion, actually is a doctor. That person should be able to answer very quickly, where did you go to medical school? Every bit as fast as you'd answer, where did you go to high school? You want to know that this person's really a doctor before they start sticking instruments in you. And ditto for the person who's going to be administering your anesthesia. Ask where they got their training. Abortion clinics have been caught letting hand holders, receptionists, and in one case a janitor administer general anesthesia. If the person standing at your head about to administer drugs can't say that he or she is an anesthesiologist or CRNA and where he or she went to school, you might wind up being yet another anesthesia coma or death. Don't assume that just because the place is operating openly that the staff are actually qualified. Red flag number 9, they don't monitor you in the recovery room. At the very least, they should be putting a pulse oximeter on your finger and checking your vital signs every 10 to 15 minutes. And there should also be a nurse in the room. Ask for that person's qualifications. Ask where they got their training. If you're not being monitored and you're not sure you're being overseen by a nurse, be ready to call 911 to get help for yourself if you start to become alarmed about your symptoms. Women have died right in the recovery room because their pleas for help were ignored by somebody who either didn't know what to do or didn't want the bad publicity of an ambulance outside the facility. Now, red flag number 10 is going to kind of come when it's too late, and that's that when you call for follow-up, you can't get through to a human being who will listen to you or take you seriously. Especially in facilities where the doctors are circuit riders, there may not be anybody on staff who has a clue how to deal with complications. The phone might ring to an answering machine. When Jennifer McKenna Morbelli's family tried to reach clinic staff, the phone rang to the doctor's wife's equestrian supply business. If you're concerned about your symptoms and you can't reach a person or you feel like you're being brushed off, seek care elsewhere, regardless of what papers they asked you to sign before the abortion. When in doubt, go to the emergency room and bring any paperwork you have from the facility. Delays while trying to reach someone can result in disaster or even death. So please, if you're considering an abortion or your loved one is considering an abortion, be alert for these red flags and be proactive. Don't be another victim.